PT before? Okay. So the usual type of PT experience, and I worked on the West Coast, I worked on the East Coast, I worked like 7 different places, and I have my own practice now for the past 2.5 years, is we're seeing 4 or 5 people at once, sometimes 3 people if we're lucky, right? But there's usually multiple people there at one time. Sometimes you have techs, sometimes you have aides to help you out, but usually within that hour, by the way, you get billed for the whole hour usually, right? You might not see the full cost because it goes to your insurance company, some of it, but if you have high deductible, you'll pay for it. Point is that, yeah, I mean, a lot of PTs will spend 10, 15, 20 minutes with you out of that hour, right? And then you'll be kind of in the corner doing your thing or with the tech or whatever. So it works for some people, it's just sort of not my model. That's all.
I've been to two physical therapy places, and one I went, and my experience was there was a lot of people with one therapist.
Okay.
The second one I went to was more like almost one-on-one because I went with one, and it might have been 2, 3 other people.
Yeah.
So you get a lot of
variation
with that.
Yeah.
And that's my experience was I appreciated that a lot more.
Yeah, for sure. And it's not to say like that. You know, absolutely that that other model where you're working with many people at once, you don't get maybe as much one-on-one attention as you'd like. It doesn't mean it doesn't work. It's just a lot of people have a lot of questions, and what I noticed is that people were leaving and I couldn't give them my full attention, and then it was like, no wonder I have to see these people 3 times a week.
Right.
You know what I mean? Because by the end of the week, it's finally I get my half an hour with them. You know, type of thing.
The problem with me is that what I saw was when I was one of say 6 or 7. And I was doing the exercises that I'm just learning. Am I doing them right?
Yeah.
You know?
Yeah.
And he or she could be, you know, watching this person over here, and I could be doing it alone.
Mm-hmm.
So that's why I thought, you know, when I had 1 or 2 other people who were therapists was working with, I had more attention, and it worked better for me.
Yep. Yeah, for most people it does, you know, truthfully, and that's why sort of my model is the way it is. I treat about 6 people a day, treat about 25, 30 people a week. And I spend an hour, my evaluations are generally an hour and a half to 2 hours with one person. And this is like not playing around, they have all their questions answered. I see people very infrequently generally, 1 time a week, sometimes less, sometimes a little bit more, but rarely. With the goal of, hey, like if I teach you well enough, depending on what it is, a lot of this stuff you can learn to do effectively on your own, right? Such that I migrate people out of the medical system such that they don't have to rely on somebody all the time. And that's the big thing, and I've done a lot of research. I'll tell you a little bit about my professional background, but you know, a lot of times it's people become dependent on other people to help them out to fix them, right? Which in some respect is, I mean, you know, it's a good business model, I guess you could say, but, you know, as far as the patient trying to ultimately get back in control, so the biggest predictor of people who have pain and stay in chronic pain is that they feel like they don't have control of their symptoms. They have problems, they have pain, they don't really know what to do with it, and then you're going into a place that's saying, hey, this is what we need to do a massage, we need to do a manipulation, we need to do something like that, which is great while you're there with the person, but then what do you do at home when you leave, right? So we'll talk a little bit about that. And I include some of that in my book and then some of the other content that I create for people. So, yeah, it's a very valid concern and point. Yeah. So we'll wait a couple more minutes here. I think maybe we have a couple other people, and they can always stop one in. And it's fine. What's that?
We're just saying it looks like it's going to be pretty informative.
Yeah,
it looks like you're going to be pretty quick.
Yeah, I get pretty wild, so you'll be good. I'll keep you entertained. Right, Mark?
Yep. Oh, yeah.
I've done, how many times have I done a workshop here before?
This might be the 4th?
4th or 5th, yeah.
I've never done one before.
I don't know, I'm sorry. You're here now, okay? No, you're good. All right. Good start. All right, my lab, we're gonna start.
My
Okay.
clock's a couple minutes fast.
Yeah, that's all right. That's okay. So I'm pretty informal. If that means at any point you need to get up, move around, or your back's bothering you, sit too long, or you feel better pacing back and forth, it doesn't bother me. That's okay. So I'm just going to introduce myself. Before I do that, I just want to make sure everybody has like 2 simple handouts. So it's just a 7 must-ask questions report. All right. There were some other reports on the back. basically like the four, I call it like the 4 pet peeves, or I forget the exact name of the report, but basically that people have with PT and how we solve every one of them. Basically how my practice does things kind of uniquely. There is that report on the back. You, sir, your name?
John.
John. So as I go around, because I think I'll do pretty well with memorizing most of your names. I can remember up to about like 9 or 10. I think there's like 12 registered, so we'll see what happens. So John, Paul, I didn't get your name?
Mary Jo.
Mary Jo. Oh,
Jo.
now it's
Mary Jo.
Mary Jo.
Right.
Now you're adding 2 names. You count for 2.
You can call it Mary.
Mary, I'll call you Mary. MJ, something like that.
There you go.
But yeah, so you have that 7 must-ask questions. You also have like that. It looks like a little quiz or something like that. It's got all the fill in the blanks. It's the yellow paper for some people. Paul, I think yours is green because you're special. Put a special color up there. I just ran out of the yellows. Yeah, nothing important there. So you don't have to answer these questions. Okay, this is not a test. You don't get bonus points for knowing all the answers.
Tell us the answers?
Yeah, we're gonna go through it. So I have my little cheat sheet up here. It doesn't have all the answers, so I make them up on the fly. They're different for every workshop, right? And basically, I'm gonna stick pretty close to the script, all right? But you'll find pretty quickly I tell a lot of stories. I do some different tangents because I think it'll be valuable for teaching. And so if at any point you're like one of those people who just has to have all the answers,
Do you have any more of those green sheets?
yeah, I think
Yeah,
so.
you got
You have
it.
a yellow
Yeah.
sheet.
Oh, mine's
Only
not.
Paul has the answer sheet.
Okay.
Green sheet, so he's going to help us along. I'm going to stick to it pretty closely, but if you want to know specific answers and I skip over them by accident, just like raise your hand, stop me and say, what's 1B or whatever, and we'll go from there, okay? All right, so welcome everyone to the back pain workshop. My name is Dr. Charlie Johnson. I am a doctor of physical therapy. And I'll tell you a little bit about sort of how and why I became a PT to start, and then I'll tell you a little bit about my professional background, a little bit about my book, how I was inspired to do that, and sort of what inspires me to get out into the public and educate people on natural solutions for back problems. So I don't know if you know this, but back pain, you all are making like a huge step just by being here. There should be like 100 people here, right? Because back pain is the #1 cause of disability in the whole world. And now we have this huge opioid epidemic, right, painkiller epidemic, and it's basically like 4 out of 10 people end up getting addicted to painkillers start with a back problem. So it's pretty crazy, so this is why I'm passionate about it, and I stay up all night and study and work really hard. And as you can tell, I'm not that old, right? So I've like done a lot of work in a short amount of time, I think, okay? So I'm passionate, I'm gonna show you guys that tonight, and I'm gonna keep it interactive. So if at any point you guys have questions, I'll save most of them for the end, but if you have something quick you want to, ask, you can raise your hand. I talk a little fast because I get excited about this. So it's just gonna be the way it is. All right, but you can slow me down and just jot something down and we can go from there. Cool? All right, so we got John, Paul, Mary Jo, but I can go with Mary. And then what we'll do is we'll go around, because in a minute here, after I tell how and why I became a PT, I'm just going to ask a few of you to share a little bit about sort of what concerns you about your back problem, what brings you here, kind of what's going on. Fair? Fair warning? So while I'm talking here, you can just be like, getting the nerves out, be thinking about what you're going to say. Got it? Cool. All right, so again, my name is Dr. Charlie Johnson. I'm a physical therapist. I do have a private practice in Royersford. How many people know where like Limerick Diner is? Cool, so I'm like right near Limerick Diner. So actually I don't even have an official sign there. I've been in practice like 2.5 years now. I was off of Lewis Road in like the middle of nowhere, basically, you never would know. Grew my practice enough to now be, my wife and I bought a house off of Ridge Pike and it's Village Commercial. So we converted the downstairs to my practice. There's actually a small tattoo shop. I don't know if anybody knows about that. You got the new light there on Ridge Pike and Limerick Road. I'm like right here and Limerick Diner's over there. So if you pass it, just start like looking. You'll see some crazy sign go up in a few weeks. All right. So I have a practice there. Again, I've only been there since like January 28th, so it's sort of fresh there. But it's great. I have parking out back. I have about 1,000 square feet downstairs, and it's just me in practice at this moment. But I'll be hiring soon. Cool. All right. So a little bit of how and why I became a PT, and then I'll get to all of you because that's the most important part of tonight. Growing up, I grew up in Schwanksville, PA, lived in Spring Mountain. I went to Perkiomen Valley High School, and I came from like a really broken family. All right, so with that being said, I knew that I had to be really resourceful from a very young age to get to where I wanted to go. I mostly just wanted to get out of the house, so I thought, hey, maybe I'll be like a personal trainer. And then I thought, nothing against that, that won't put me far enough out of the house. So then I said, well, maybe I'll be an athletic trainer. And then I thought, well, you know, if I want to, you got it? Thanks, man. Appreciate it. If I want to be with my family one day, which I want very badly, to have a family life, right, which I didn't have growing up, then I'll be traveling all over the place. So I played ice hockey, I was into like eating well, exercising, like all that stuff, right? And I wanted to be an athletic trainer for the Philadelphia Flyers. I was like, I was a goalie. I was small, but I was fast. I got hit in the head a few times, and maybe that's why I am the way I am. But the point is that, yeah, so I thought, well, hey, if I'm traveling all the time, I can't be home. Now I have a 17-month-old daughter. Her name is Cameron. She's super cute. She won't be here later, but she's at the phase where she's saying, like, no, no. And she grabs her thing. And she says, like, mine. You know, grabs her stuff. And I'm like, where did it come from? Maybe daycare. I don't know. But the point is that, you know, I'm blessed to have her right now. And then my wife, we started dating when we were 16, so high school sweethearts there. We went to Perkins Valley, like I said. And so we now have our daughter. And usually, again, my wife's here with us. She might pop in later, but I'm learning to do things on my own now. All right? So, yeah, so with that being said, I thought, well, what can I do other than personal or athletic training? I don't know why I didn't look into chiropractic, which is fine. I have nothing against it. I just said, hey, I'll go to physical therapy school. It was like one of those quick Google decisions. I didn't play around with it too much. I said, all right, this is what I'm going to do, right? And plus, it got me out of the house, and it was like a professional degree. I wanted to, like, I was at the phase where I was like, I need to do something big, right? So what I did is I applied to PT schools, and what I realized pretty quickly is that, like, it costs a lot of money to get into these places, right? So I applied to Lebanon Valley College, which is in central PA, like Hershey, Anvil area. Got accepted, and they were like, okay, here we go. And then it was like, sign it out of line, and I don't have that type of money, right? So point is, I didn't have anybody to co-sign my loans to get me into college. So through the goodness of her heart, and just like, I didn't even ask her, I got really close to my high school guidance counselor. Her name is Carla Zielinski. She still works at PV, and she knows I bring her name up. She knows she's on film and all this stuff. She's cool with it. She co-signed my loans to get me into college. So pretty cool. She gave to me in a huge way, and I try to give back to the community, and obviously, like, I kind of had to make it work at that point. So, you know, I had to keep fighting for her. So I'm very grateful for that, and that's a little bit about how and why I became a PT, all right? So now, dun, 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 I'm going to go around, right, and I'm just going to ask, I don't know, 3 or 4 people to share a little bit about what brings you here, what concerns you. If you can just say your first name, I'll do the best I can to try to remember it, and we'll go from there. Cool? You want to start?
Beth, my name's
Beth.
Beth.
Good to meet you, Beth.
Good to meet you.
Yeah.
I have had a history of back issues. I forget how I thought I was overdoing it at the gym. You know, I would take a cycling class, then go to the gym to open the gym. Before anybody got there, I would do 3 sets of 12 exercises of all the major muscle groups, and then teach 2 classes at 12.
Okay.
And then, you know, go out for my 5-mile walk after that.
So you're
This
very
is in
active.
my younger days.
Younger days, all right.
And then I started having really debilitating lower back pain, and, you know, I wasn't even moving. I was just laying in bed. It was so bad.
Yep.
But then, I don't know if I went to physical therapy immediately for that.
Sure.
But I had been to physical therapy on numerous occasions for my low back, and I
Yep.
think physical therapy really helps.
Yep. Cool.
You know, I've had issues with my piriformis, I've
Yep.
had, you know, but to make a long story short,
Sure.
I've been battling my low back for about, I don't know, 25,
Oh, that's a long
30
time.
years.
Can everybody beat that? If I had a trophy, I'd give it to you, but I don't think you want one for that. So, okay, so a long time, 25, 30 years, all right?
Yeah, but you know, I know what, I do my exercises, and,
Yep.
you know, and if it gets to the point where it's hurting, I'll double down and really do my exercises.
Okay, got it.
But
All right.
Anyway, so go ahead.
No, thanks for sharing. So, what brings you here? So you've been dealing with this for 25 years. What makes you say, I want to learn more? Okay.
I didn't know about,
Good.
but I'm really interested. I want to,
Yeah.
I love to learn.
Okay.
I want to see what you have to say and
Cool.
know where you are.
Good, good. Okay. Can you share? Just because
Yeah,
you brought
sure,
her here,
easy.
so
I
then
brought-
we'll
It's my
randomly.
birthday.
It's her birthday?
No, it's my birthday.
Oh,
And so I
do
brought
we
my-
need to sing?
No.
My daughter is very well at that.
I bet she does.
Happy.
I teach 2nd grade.
Okay, cool.
So my best friend Beth here, I took her tonight because I thought it'd be fun for both of us to learn something.
Good, awesome. Thanks for
And
bringing it.
I've never really had back pain.
Okay.
I play tennis, golf, yoga, stuff like that, and walk, but I just did.
Okay. Your name,
Ellen.
Ellen.
And I'm not sure what really happened, but I think I was yanking out a holly bush and it didn't go well. And it was so bad that I like couldn't get out of bed, and as a teacher, that's not gonna work for
Yeah.
second grade.
Sure.
So I just went to so you went to
She
the
called me
doctor.
and said, what should I do?
That's right.
I said, go to
Previous
physical therapy.
experience.
And I said, I went to one physical therapy and I thought that, I was lame, so lame.
Yeah, fair.
So lame.
And that's okay if you think PT is lame.
I'm sorry.
Or
I wanted it to be.
seriously, I mean, or if it's great, it's fine. Everybody has their own opinion about it, so it's good. We'll talk about it.
But I got lame.
Okay.
And I only went once and I'm just like blowing that off because.
Yeah.
Yeah, so
Okay.
that's where I am. But I'm better now, but I'm not 100%.
Okay.
And I don't want to have this again, so I want to learn all I can so that I don't have that experience again.
Cool.
So I did not want
Good. Bad experience.
that. Yeah, not want that.
Okay. Let's do one other person. I knew you would want to volunteer. Mary Jo, go ahead.
I went to a chiropractor for years until 2009 when I broke my femur.
Yep.
And when I tried to go back to him like a year later, he said no because I had Aetna insurance. He didn't take Aetna insurance anymore.
Sure.
So I haven't been to a chiropractor since 2009. And I sciatica off and on during that time, and he fixed me when I go. So now I had it again 2 or 3 years ago, and it went away on its own. I forget how long it lasted, but then I went to physical therapy a year and a half ago, September till February last year, before I got it this time. This time I've had it since February.
Okay.
And I need help deciding what to do, whether I should go back to physical therapy, find a new chiropractor, or what I should do about it.
Yeah. Remember, I'm a little biased. We'll talk about that.
Yeah.
All right. All right. Cool. Okay, so you need guidance or
Yeah.
coaching about which direction to go and sort of what to do about it in
Right.
order to manage this
Because it
problem.
hurts, yeah.
Because it hurts. Fair. Yeah. All right, got it. Okay, so real quick, some names. We got Paul, right? We've got John. I know John. We got Ellen, Beth, MJ, Mary Jo. Your name, sir?
Chris.
Chris. All right.
Helen?
Helen and Ellen. That's easy. So I can just say Ellen really quickly and we'll be good. Your name is?
Joyce.
Joyce. Okay, I'll do the best I can.
Mary.
Mary, Joyce, Helen, Ellen, John, Paul, Chris.
Wow, good for you.
Yeah, that was like 2 seconds after you said it. Okay, so, all right, so let's do this. Ready? So we're going to start with the worksheet, right? And again, we're going to quickly veer off of that, but it's a good entry point, all right? So first things first is like, Mary Jo, you said sciatica, right? So some people throw this term around, right? And anybody else who didn't share, Chris, whoever, right? Maybe you've had sciatica or you've heard it or you've thought you've had it. But the truth is it's actually very rare. So the first thing is, and I'll explain this, I want to start off with like, what is it? So what do you think it is? There's no right or wrong answer, it's fine. I put things in like real lay terms here. All right, so what is sciatica? So start off, just like basic anatomy, right? The sciatic nerve is the blank nerve in the body.
Longest.
Yeah, largest and basically longest, all right? Although the whole nervous system's connected. So I say largest, but if you want to think of it that way, that's fine too. And what I say is it actually is split nerves. That's actually kind of a lie, but we'll talk about it. All right. So get this, all right? So I'm going to do a lot of drawings. If at any point you guys can't read, I'll move, all right? So they start off good in the early part of the night, and then they get worse as we go. All right? So what's this?
A guitar.
Perfect. That's actually, it does actually look like a guitar. I like that.
That's our point.
So, all right, there will be your knees, there will be your knees, there will be your feet, right? So you're looking from the back to the front, all right? These would be like the spikes on your back, this will be your hips, and there will be like your sacrum, and there will be your tailbone, all right? Get it? It's a human guitar, right? So there's 5 bones in the lower back, just basic understanding of what's going on, right? So this would be L1, L2, 3, 4, 5, and so on. This would be the sacrum, so this is where you might see L5S1, L4, L5 is the most common problem, especially with the disc issues. But that's sort of just the basics there, all right? Now, sciatic nerve, basically, 3, 4, 5, S1, so on and so forth, is made up of kind of 4 nerves that come out of the main spine. So here we the spinal cord and branches off of that, right? And then it forms into this bundle that's now called the sciatic nerve, all right? So the sciatic nerve is actually multiple nerves, in fact 4 nerves that come together in this bundle, and it's about yay big. So pretty thick. wire going down the back of the leg, from the back, down the back of the leg, into the foot. That's an answer. It's on your sheet. From the back, down the back of the leg, into the foot. All right? But the point is, I used to teach gross anatomy at UCLA, University of Southern California, as well as Penn State. And I mean, it's a big nerve, so I would tie strings around this wire and test people, what is this? You know, that's an easy answer because it's a big one. But the point is, I've seen it a lot, and it's a big wire, all right? The reason I say it's split nerves, because after it joins, it goes to the back of the knee, and it splits, all right? So what it does is it goes one direction and goes the other direction. One of the splits comes around from behind the knee to the front of the shin, or to the outside of the shin, towards the top of the foot to the big toe, all right? That's one branch. The other branch goes straight down the back of the calf, just around the inner ankle bone to the bottom of the heel. And what we see is that if this is, bad drawing, that's foot. It's not a guitar, that's, what does that look like? Kind of looks like a ghost. A dying ghost, but a ghost is already dead, I guess. Whatever. So the point is, if I was to take my foot and stamp it up there, right, this is the inner ankle bone part, right? One of those branches comes around, goes around the inner ankle bone, and then ends towards the bottom of the foot, but it branches right around where most people complain of like having plantar fascia problems. So it's kind of interesting, a little suspicious. We have some research correlating it, but a lot of times I'll see people with chronic plantar fascia problems who also have had a history of sciatica. And really what it is that, by the way, you go to the foot doctor and everything's a foot problem, right? And you go to the back doctor and it's going to be a back problem, and hopefully you can find somebody who can see big picture, right? But the point is that those nerves cause pain right around where people have plantar fascia problems, right? So often what it is that somewhere up the chain, in the back because of a disc problem, arthritis, whatever, down the back of the leg, piriformis, something like that, the nerve has been irritated in the past, and it has a memory of that. So then you get a little irritation on the bottom of the foot, and you have plantar fasciitis. It's not really plantar fasciitis. A lot of times you treat the back and the foot pain goes away. So kind of interesting stuff, all right? Not everybody has that experience, but I throw that out there because I've heard it commonly.
Good question.
Your name again?
Mary.
Mary.
It's really coming out both sides though and going down both legs,
Yeah.
so it's really sciatic nerves to be,
Yeah, you have one on each side.
okay.
You got it?
Yeah.
So yeah, and this is the main tree trunk. Go ahead, Paul.
Shin splints, is that the outside part of it then?
Yeah, so most people with sciatica, or several people I've treated with sciatica in the past, have this complaint of like pain right here. They get acupuncture, they get massage, they get different things, and then you do something to the back and you'll be able to bring on or make better their shin pain, right? Because this is the distribution. Each of these wires carries a specific mapping, meaning nerves like highways, they carry information such as feeling and movement, meaning at any given point, one of these wires, just like you have lamps that are connected to wires in your house, you can turn them on and turn them off. Same thing in the back. So what we did is we said, hey, we want to know where the fifth nerve in the back kind of gives feeling to. And we can actually draw, if you look in the books or look up, you know, a nerve problem, you'll see all these mappings with different colors. And you'll see that the fifth nerve in the back actually causes feeling changes kind of back here, the buttock, outer hip, down to the outer knee, to the shin, to the top of the foot. The first nerve in the sacral area, the S area, will cause buttock pain, pain on the back of the thigh, into the calf, to the bottom of the foot. So based on where somebody describes their symptoms, you could either say right away that's probably an L5 problem if it is related to the back, and or the other tricky thing that people think is sciatica is actually problems within the hip. People get an achy shin when they really have a hip problem. So we know that when we inject hips, we can see that people feel the pain all the way down to the shin area. Not usually the foot, but to the shin, all right? So, does that make sense? All right, now, so that's the sciatic nerve. People with sciatica, this is the last little answer there, number one, may experience pain, numbness, or tingling. They're the most common complaints, although I will say, some people say it feels like burning, it's shooting, it's electric-like, feels like water's trickling down my leg. Somebody once told me recently it was, feels like ants are wearing stilettos. They were a very creative person. I valued that, you know, it was good. But the point is, true sciatica is very rare. Only about 4 out of 100 people, so 4% of people who have leg pain actually have true sciatica. So just because you have leg pain doesn't mean that's the cause. In fact, it's actually probably not the cause. All right? Because you have leg pain, and then you have one type, which is going to be sciatica, and you have another type, which is going to be referred pain. I'll make this super simple. This is a nerve problem. This is not. So a nerve problem, people with sciatica, right, they generally have leg pain worse tin back pain. Sometimes they barely even notice the back problem. A little achy, but my leg is on fire, right? Generally, below the knee is most painful. So when they say leg pain, it's in the shin, it's in the foot, something like that. So lower leg, right? It's very narrow band, meaning it's like they can trace this thing. It's going right there, right down my leg. Sharp, shooting, electric-like, jolting, very narrow, usually about like an inch in diameter pathway. They can trace it, and when they draw on that little gingerbread diagram where their pain is, it's like a line with an arrow on it. It's very specific, right? And if you have sciatica, there's a simple self-test. Lay on your back and try to stretch your hamstring on that side you think you have sciatica. If you're stretching your hamstring on that side, or you're pulling your leg in that position, and you can do it, and it's symmetrical to the other side, and it doesn't stop you dead in your tracks and shoot zapping pain down your leg, you don't have true sciatica. So then the question is, well, what is it? 96% of people have this referred pain. This is the most common type of leg pain that you can get. This is not a nerve problem. This is some other tissue or structure in the body. This is a disc problem, this is a joint problem, hip joint problem, back joint problem, something like that, right? That can actually send signals elsewhere in the body. So if you've ever had I don't know, somebody pushed on your shoulder or found a knot or something like that, whatever, you might feel it like traveling down your arm, or you feel it somewhere other than where they're pushing, right? So the point is that you can apply a stimulus to certain parts of the body and actually get a feeling that's felt elsewhere in the body. And what I mean by this, and how I know this, is that we've done studies in the past where healthy people who had no back pain and no leg pain or anything were injected with painful substances into certain areas of their body because we wanted to learn where these things cause problems, right? So we took, for example, somebody, we injected the 5th disc in their lower back. They had no pain, they didn't mark anything on that little diagram. And then afterwards we said, all right, give it a few minutes to set in there. Say, oh, I'm feeling it. Where are you feeling it? And they would say, oh, I feel it a little bit here, definitely, but it's kind of going on my butt, it's going on my outer knee, it's really bad in my shin, so on and so forth. So the point is that you can have sciatica, a nerve problem, right, and that's very specific, but you can have referred problem that sends symptoms all the way down the leg. Usually it's worse above the knee versus it's usually worse below the knee. Back pain is usually worse than the leg pain, but the thing that really differentiates this is that if you stretch the nerve, in this case you're going to zap it, in this case it's going to look normal, so your nerve can stretch, it's just a wire, all right? And it's very diffuse and achy, it's not specific, it's just, oh man, it's just really aching in my shin. Really, when I drive too long, it's really aching in my hamstring. I think I have tight hamstrings when I drive too long, or my butt, or something like that. So very general, diffuse pain, hard to localize. Stretching the sciatic nerve, in this case, is normal. Here it's going to zap you. Back pain and above knee pain is generally worse in this case versus below knee is generally worse in this case. All right, don't get overwhelmed by it. Just know that very actually uncommon, simple self-test you can do versus referred pain is more common. All right? Cool. All right, so now, real quick, I want to cruise through this because I have a lot to cover. But basically, who am I? How did I come to specialize in back and pelvic pain? Just get that in school, I was somebody who always wanted to know everything, and I still am. So with that being said, I realize we're in medicine, and it's definitely an art, right? But I try to get closer and closer to the truth as much as I can, right? And I use research, and I use experience and the top people out there to try to figure out how to do that. When I came out of PT school, unlike in PT school, there was nobody there to answer my questions, right? In school, I could just raise my hand or email a teacher, and it was all good. And then when I came out into practice, it was like, how, when I'm seeing 4 people at once, and you're seeing 4 people at once, am I supposed to like get any feedback here? I was looking for a mentor, basically, right? And the issue is that so many people in healthcare have just gone into it, and they just follow the whatever, follow what everyone else is doing, right? And they just start to deliver treatment that's just like very quick. They don't really think anymore. They don't challenge themselves, and because of that, you just get like this kind of cookie cutter approach, right? And so when I would ask somebody about what to do with a patient I was struggling with, where I really wanted to help, it would be like, well, just throw a heat pack on them, or do, and I was like, it's got to be a better way to do that, right? And I was like, but not here. So where? So what I said is, I'm going to go to the best place in the whole world to figure this out. So what I did, and most people don't know this, but if you have a heart problem, who do you go see? Let's just start with that. Yeah, everyone knows that for the most part. If you have a foot problem, who do you see? Right, most of society knows, it's not everyone, but pretty much it's kind of like given, right? So if you have a back problem, right, ideally in the future, even now, you would go see a board-certified orthopedic PT. If your kid had a problem, you would go see a board-certified pediatric specialist, a PT. If you had a stroke, you wouldn't come see me, you would go see a board-certified neurological PT. So the point is, within PT, we actually have board specialties. The problem is that of people who have specialty training and have their board specialty, it's about 0.5% of all PTs in the whole world. So the point is, you're pretty much not going to find one. So the issue is that society doesn't know about it yet. But the point is, I said, well, I want that, because I'm a go big or go home guy. So I applied to residencies, which are specialty programs in PT. The best of the best are out there. This is where all the people writing the books and everything, that's what they're teaching, right? So I went and I applied to USC and I got accepted. University of Southern California, #1 program.
You didn't pay $500,000 to get in?
No, yeah. I've heard the whole uproar lately. I didn't have anything to do with it, okay? No, it was cool because I got the USC education. I paid like $2,000 or something like that. It was great. But yeah, there are a lot of PTs coming out there with like $300,000 in debt. It's crazy. Anyway, that's another topic. But so I got the USC education and kind of the name recognition, but maybe not a good thing now. But you know, I didn't go on crazy debt over it. So point is, I flew out there, brought my wife cross country. She stayed back because we were planning to get married here in PA. I drove back. We got married in like Meredith Manor in Pottstown. But long story short, I went out there and I did research on back and shoulder pain. I taught in the PT program. I worked with Mike Trout and the Angels during spring training camp. You know, I was mentored by other PTs. I worked with spine surgeons, shoulder surgeons for the Kings, Dodgers. I mean, really cool experience out there. All my questions could be answered. It was an academic setting. It was great. Well, then it was like, okay, you're done. We trained you to be a sniper, really thoughtful about what you're doing and why you're doing it. You're like the best of the best now. And it's like, go back into the real world. And I was like, well, how's that going to work? So then I practiced for someone else, and I was seeing like 50 people a day again. I was like, I can't even apply half of what I learned, 3/4 of what I learned. I feel like I could give so much more. So the point is, that's what inspired me to open my own practice, where I see people, you know, in a more quaint private setting, if you will. So I also wrote my book out there because there was a lot of opportunity that I had. That I was like, I have to share this stuff. So while other people were studying stuff, I was studying and then trying to like record it all, right? So that's where we got that. All right.
So where do you get your mentorship?
Yeah, so my mentorship was mostly at USC, right? So it was we had 52 to 57 weeks, basically the program. We had 52 weekend courses. So we didn't have one weekend off except for maybe 1 or 2 around a holiday the whole year. So it was like I'd be in the clinic teaching, going to work in the clinic 30 hours a week with a mentor who would come in and watch me and say, what are you doing? What are you doing? Why are you doing that, right? And then we would go, I'd be in the OR with the surgeons, I'd go teach, whatever. We'd do all this different stuff, and then we'd have tests and this and that. And then on the weekends, we'd fly in people to USC from all over the country, all these, you know, the people, osteopathic physicians, chiros, PTs, all the people from the best in their area, and then we would have courses. And it would just be learn, 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 learn. And then when we got done, and we went back to the clinic, we could implement it, and then when we got out in the real world, then it's like, now I'm just refining it, right? So now what I do is I do some adjunct work at Lebanon Valley, where I went to school. I have a mentorship group online where I try to teach other PTs what to do. I mentor other PTs. So now it's kind of like I've gotten the hang of it enough to where I can start to teach it, right, which is cool. That's how I carry it along.
Can you do myofascial release?
We'll talk about this.
Okay.
Cool, it's going to come up. All right. All right, so I offer one-on-one PT, one-on-one care. That's the fill-in if you really want that, all right? 7 must-ask questions is just a report basically to help you identify, you know, a strong healthcare provider. In this case, a PT. Basically, I have a YouTube channel, and people would reach out to me from all over the country and say, well, like, I have this problem, can you help me? The telehealth laws are kind of funky, but basically I would say, like, hey, we'll go to a good PT. And I was like, well, what does that mean? I should probably define that. So then I created this report, okay? All right, so first step, when you go to anybody for your pain, numbness, or tingling, back pain, leg pain, whatever it is, the first step we need to identify is it reproducible? Meaning, there's 2 types of pain problems. There's one that's mechanical. You're driving down the road, you push on your brakes, it goes, and you can just reproduce it, right? It's reproducible. There's something clearly about when you do this, this happens, right? That's mechanical problem. Think mechanical. Squeak, squeak, move this, right? Versus there's another type of pain problem, a very chemical problem, meaning these are the problems that keep you up all night, you can't find any relief, you can't sleep, pain is constant, it's very severe. Chemical problem, chemical intervention, medicine. Inflammation is a chemical problem, medicine. So many people with mechanical problems are taking medicine and it doesn't give them relief. Because yeah, you have something clearly that aggravates it, and then when you stop that thing, it pretty much goes away. There's no chemical problem going on there. Once you stop what hurts it, it goes away. It's mechanical. You can change it. So we want to know if it's reproducible, right? It's often reducible. So you can just erase this, right? So if you can turn the light switch on, my daughter, ooh, she can shut it off. That kind of thing, right? So the point is that there are many things, reducible. There are many things that make lower back pain, leg pain, shin pain, whatever it is, worse. So let's start talking about some of these things. So what makes it worse? It could be like lifting or working out or spinning or something like that, right? So exercise, potentially. What else?
Standing for a long time.
Cool, how nice. So standing.
Yeah, in one position especially.
Yep. What else?
Sitting too much.
Yeah, sitting.
Sitting.
The opposite, right? Go ahead.
Being on a concrete surface.
Yep, concrete. We probably got driving then, if sitting's there, right?
Bending,
Yeah, bend. Keep going.
Laying down.
pick up sticks.
Lifting.
Pick up sticks. Lift. Anything else? Doing dishes, chores, rolling over in bed. I mean, you could go on and on, right? The point is that notice that Helen said standing, and then he said sitting, right? It's not that he was arguing with you. Just in your own brains, you have a clear idea of like, for me and my problem, this seems to make it worse. Or, like we said, if you know what makes it worse, then for him, I don't know, I could be wrong, oftentimes what you'll find is doing the exact opposite might make it feel a little better. Maybe standing up, walking around might make it feel better. For you, sitting down might make it feel better. I could be wrong. But the point is that generally, if you can make it worse, you can try to find something that makes it better. Okay? Not all the time, but most of the time. Now, there are some people that everything hurts. It doesn't matter what they do. They just look in the mirror, it hurts. They think about it, it hurts. You know, laying, standing, sitting, sleeping, whatever, they can't do it. Right, about 1 out of 100 cases, so 1% of these people might have something more serious. We call these red flags. This would be somebody comes to me and they say, hey, I'm losing weight, I'm not feeling too well, my back really hurts. And I look and they have a history of prostate cancer and then they have abdominal pain. The more I ask, the fishier it gets, right? So spinal tumors, kidney stones I've picked up before, infections, rare but can happen, usually younger people and higher up in the spine. You'll see ovarian cysts can sometimes cause this, gallbladder problems, so on and so forth. So the cool thing about going to a PT that's well trained as the entry point, I used to work in the urgent care and the emergency room in Flagstaff in Arizona. And we made a huge economical, positively, impact on the community because PTs were the first person you saw when you went to the ER. How cool is that? Really cool. Because we're trained on all these rules of when to order x-rays and when to do this and when to do that. And nurse practitioners or PAs half the time don't even know that. So, and about 60% of cases that go to these places, the urgent care right down the street, is going to be because they have terrible back pain, they don't know what to do, or they hurt their knee, or they tripped and sprained their ankle. And it's usually just, hey, take this medication and it kind of looks bad, so go get an image. Versus like following any scientific protocol of like, well, I could teach you to tape your own ankle and walk out of here so you can feel better, and here's what's going to happen, here's what you can expect, so on and so forth, right? So we educate a lot of people there, and instead of getting a CT scan for thinking they had a stroke, it was just vertigo and we could fix it. Like, really simply, right? So crazy. So the point is go to a PT, they can screen for these things and then refer you out as needed. A lot of times people think they need an image, they need to go to a physician first. In most states now, and most PTs, you can go right to a PT without a referral. Medicare is different, that's the only time you need a referral.
So you said if you can reproduce it, then you can reduce it. I thought that was interesting.
Yep.
Is there a general, like, apply heat always or apply ice always? Is there anything, like, about that?
Yeah, so there's
Within
no...
a certain time frame, you're supposed to do one and the other?
Yeah, so we used to think there was, and now we actually think that sometimes putting ice slows the process. Just like taking Advil for too long will slow the process. Because you want the inflammatory reaction to occur.
Recovery process?
Yeah, because you want the inflammatory process to occur. Because it heals things. If you start trying to say stop, stop, stop for too long, maybe immediately, right? But for too long, you actually slow the process. So we don't have strong evidence for ice, we don't have strong evidence for heat. That's just the truth of it. So I say if somebody has a preference, do it. And you learn by doing heat, which is the very opposite of cold. Go 2 days with heat, go 2 days with ice, or go an hour with heat, an hour with ice, and see what you like best and do it. Really the biggest thing is we tell people to stay as active as possible. They don't want to stay active, but stay as active as possible. Most people just lay on the couch.
What about a brace?
Yep. Yeah.
Good with sciatica?
So it depends if it makes it feel better.
If your tummy is pulling on your back, see, I feel that that's the reason
Yeah.
that I'm having it.
Yeah. So that's a good question because you're starting very intelligently in that you're starting with the question, right? So what we see is that back pain is very difficult to diagnose, truly. We know that 80% of cases are due to disc problems. But the problem is that there is no correlation between imaging findings and symptoms. And the problem is people are getting images saying, and then they're being told with a trump card now on themselves, right? You have arthritis. You have a herniated disc. There is no correlation between any of those findings and symptoms in the majority of people. So they're very expensive images. Here's when images are useful. If I think you have a spinal tumor because you have other factors that would make me think that, and you are not responding to hands-on treatment for a month, 6 weeks, something like that, then I'm going to tell you to get an image. But otherwise, unless, if you just have back pain, an image is almost useless, right? But if you have back problems that maybe look or are suspicious for a tumor, infection, or fracture, absolutely, go get an image. Otherwise, it doesn't tell us much other than you have arthritis. And everybody has arthritis above 25 is basically what we found.
Really?
Yeah. Yeah, so you see, and I'll go through the stats at the end, it's basically 80% of people over the age of 50 will have spinal stenosis, arthritis, degenerative disc problems, and feel no pain. There is literally no correlation unless the story adds up and you put the image on top of it. That's when you can correlate things. But in and of itself, they're not helpful. Right? So the thought is, though, you're doing a great job, Helen, by saying, hey, I think my tummy has to do something, is pulling on my back. So then my job as a coach is to say, let's prove it. Because everybody in here might say, well, what are the best core exercises? Well, who's to say for your problem you need core exercises? It's just like a theory that gets thrown around the internet and people tell you should strengthen your core. But in fact, I've treated just as many people that I've said, hey, you're a personal trainer, you have terrible back pain. That's weird, you strengthen your core all day. Why would you have back pain if that was what was really needed, right? So I tell them, stop strengthening your core. For the next 2 weeks, go cold turkey and live on the opposite extreme. And they say, I feel so much better. So now we have evidence that people with back problems actually have more stiffness, meaning they walk around like a plank because they're guarding, right, because their back hurts. So then, why would I put them in a plank? I'm not saying I don't put people in planks, right, occasionally, but the point is it starts to question that. So it all starts with a question and a hypothesis of, if your belly is part of the problem, well then let's prove it. And that's what I do.
Okay.
Yeah, but a brace, all right?
Yeah.
If a brace helps, a brace helps, right? But at the end of the day, we know there was a Home Depot study because they wanted to see if back braces help reduce back problems. And it actually did help. Was it because it was placebo? Was it because it gave people confidence that they felt like their core was tight or whatever? Who really cares? It helped. So if it helps, then okay. But really, you have to understand there's a difference between putting out the fire. So everyone I see in here, right, if you were to choose to work with me, whatever, we'll talk about at the end, right, has some fire burning, meaning their back hurts and they're doing something to keep it brewing. Something's going on such you have a back problem for 30 years, right, and you're just not aware of it. Or you have some exercise and you just haven't quite figured everything out, all right? But the point is, the first step is you have to put out the fire. So you got to calm it down. So you have to find what things make it worse and try to tweak thoughtfully, modify, temporarily avoid sometimes, but that's not a long-term solution, right? Or become more intelligent about doing those things such that you can stop nicking the scab. And then from there, that's not the whole solution. You're just calming the fire down. So your brace is calming things down potentially. Feels like I feel better, but then take the brace off and what do? That's when exercise and or further techniques would come into play. So it's a twofold approach. You got to put out the fire, kill the angry birds, the things that are making it worse, right? And then you have to go and then you have to do some type of intervention. Starts with the question, if my core is a problem, then how do you answer that? Strengthen the heck out of your core for the next month and do nothing else. And then how do you feel? Same, better, worse. The issue is people, I love it, people say, I go to yoga and made my back feel so much better. That's great, you can keep doing yoga, no problem with that, right? But what made it better? Yoga. Well, what about yoga? It's an hour-long class that they do this motion, and this motion, and this motion, belly tight. You don't know if it was core strengthening. So therefore, you're in Arizona and your back hurts and you're just gonna bust out a yoga program? I guess you could, but ideally what we do for time efficiency and for education is it's a process of discovery such that when we chat together, right, it's like, look, here's what we've got going on. Here are the various hypotheses. It could be your belly's pulling your back and that's part of the problem. It could be you don't have enough motion in your back. It could be that it's your hip, X, Y, and Z. I'm making this up, all right? Let's systematically weed out every single one of them such that then, if something doesn't work or makes you worse, you know exactly that that's what it was. Only 1 or 2 things at a time. I don't give people a sheet of exercises and tell them to sit in the corner because they go to PT, it makes them better, and they're like, well, I was stretching my hamstrings, and I was strengthening my hip, and I was doing some core exercises, and then I was on the bike, and I'm like, well, that's great, you feel better, but you don't actually know what made you feel better. And as a mentor to other healthcare professionals, they don't know either. They got lucky, basically, right? So the goal is I don't want to just get lucky, sometimes I'm sure it happens, but I want to discover through the process what 1 or 2 things can you do on your own such that you can treat yourself and get yourself out of the healthcare system so you don't have to rely on somebody all the time. When you're anywhere in the world, you can treat your own back problem. That's the goal. It's not that easy, obviously, but, that's what we shoot for. So it's a good question. Okay, see how I get off this thing? Where are we? Alright, so, cool. Single biggest mistake people make with back problems is I actually think this is maybe a good thing, but we'll talk about it. They ignore it. So they say, my mom had a bad back, I don't know, it's cold outside, there is some truth to that. But my friend sneezed on me, or they're sitting next to me and now I have a back problem, it's all your fault, so on and so forth. Alright, so they ignore it. They don't do much about it because they think it'll just go away. Or they're tired of the medical system, they don't want to go see a doctor because they think it's a waste of time or whatever, and that's it. Or they thought PT was lame or their chiro was whatever, okay? So the point is people ignore it. Next thing people can do to handle it, or to, work on getting to the bottom of things, they could alter it. So people try to alter the problem, they try to camouflage it, right? They try to say, okay, so I had a lady call me. I offered to help her for free. It's a long story. But basically, she said, I don't think I want to work with you yet, even though you're going to help me out, because my doctor said I should get an injection. I said, okay. You're going to put out the fire, but you don't know anything about what started the fire. And here's what people do. They're sitting, I had a guy, terrible back problems when he sat too long. He said, I'm going to go get an injection. I said, that's fine. They help 2/3 of people. That's the truth. 66% chance of relief. How long? A day, a month. When I worked with surgeons, 2 years. It can help, for sure. Don't get me wrong, right? But if it's mechanical, and you can bring it on, bring it off, you probably don't need to go to that extent, number one. And then number two, they don't know anything about, and they don't dig into anything about their story or what's really going on, such that then when they go have the injection, they lay on the table passive. They just lay there. Ow. They scream, wiggle for a little bit, get the injection, all right? And then they go on with their day. The surgeon doesn't tell them anything else, and then here this person is, they have terrible pain driving or sitting, and then they go get the injection and they feel great walking out. They feel great for a week or so. And then they call me back a couple weeks later and said, I thought I could get away with not calling you again, but I just got back from Kentucky. I took a long drive down and I can't figure out why my back's killing me again. Because you went in and driving and sitting was the primary reproducing or aggravating factor that started the fire to begin with. Then you had an injection, it felt good, which you thought you could be Superman or Superwoman and do whatever you want. And then you drove to Kentucky for however many hours it takes you to get there. You did exactly what nicked the scab to begin with, and now you wonder why you have a problem. It's fine, because it can get complicated, but people usually don't put 2 and 2 together. So those injections generally alter the symptoms. Same with medications, right? It's not that I tell people to avoid them all the time. Sometimes the fire is burning so hot that people walk into my clinic and they can't move because their back is so bad. I might say, I'll see you in a week and get an injection. Or take a steroid pack because it's so hot to handle, it's like, ooh, ah, eat, and I can't touch them. You know what I mean? So I can't do my job, then I can't help you. So you need to calm that down a little bit more to where me standing there with the fire extinguisher, I can actually do something. It's not just going to engulf me. All right? So helpful sometimes, but a lot of times it just alters it. It doesn't really get to root cause. Right? And well, let me ask you this. So when you have an injection, let's just say you have terrible arthritis, and that's what they tell you is going on. And then they give you an injection, and then you have no pain. That's good. What did it do to the arthritis?
Still there.
Still there. Why do you have no pain? It could have been because it was never due to the arthritis to begin with. If nothing about that structure changed, and that was truly the problem, then how could you just inject the thing, don't change anything about structure, and then you have no pain, and in the other scenario you do have pain? This stuff doesn't make sense if you really think about it. Okay, so alter it. And the third way you could do, if you really want to get the body, you can handle it. This is usually like, hey, what's root cause? What's the discovery process to really figure out what's going on here? All right. And I would say, look, the first thing I do to people when they give me a call, when they say, "Can you help me?" They say, "What's the first thing I do?" I say, "Stop everything." And they say, "What do you mean? I have to feel better. I have to find out what the answer is." I say, "You don't even know what the answer is because you're doing so many things right now: yoga, doing YouTube exercises, wearing a back brace, taking medication, going to the chiropractor, seeing a massage therapist. Like when my daughter dances in a puddle, that's what it looks like to me, as somebody who sees thousands of people with this problem. It's just like, she's going all over the place, and I'm like, how am I supposed to know what's going on? We've got 70 different, cooks in the kitchen, and then there's no way that adding another thing, right, is going to make that any more clear. It's just going to add another stomp in the puddle. Right? It's just going to make the water more muddy. Right? So I say, ignore it temporarily. Do nothing. Get a baseline. Let it such that the water is crystal clear. You ever go on a lake like in Poconos or somewhere around here, just looking, it's like, it's so peaceful. Right? Not crazy. So calm that down, and then just throw one thing in the water. What happens? Learn about that. Get feedback from it. The fish always go that way. And then you start to learn from it. Okay, so now if I wanted to catch the fish, rather than trying to throw all these nets in there, I can actually see where they're going, and I can study that. Okay, let's go over here next time. Do it again. I proved it again. Do it again. And then you got all the fish you want, right? Because you actually discovered the process of how to handle this thing, right? So the biggest, I would say, truthfully, now that I've done this enough and worked with literally thousands of people with back problems, the single biggest mistake I would say is that people do everything. And the problem is that you have a finite amount of energy in life, and people disperse it way too much. So for example, if this is the sun, this is what back pain treatment looks like. This is why people can't get anywhere, in most cases. Or if they do, they don't know what did it. Sun, big ball of energy. Here you are, this is you, you're standing there, trying to just help yourself, right? You got PT over here telling you one thing. PT, they're doing 10 exercises. The chiro, they're telling you that you're out of alignment. You're going to a massage therapist, you're getting myofascial release, Chris. You're going to the primary care physician, you're going to the surgeon, right? And the point is, understand this, not only are you going 5 different directions, which if you want to get anywhere, have you ever tried to get on a plane and say, go this way for a little bit, go that way, go, you're just going to be like, dude, where do you want to go? You don't have any destination there, you don't even know where you're going, right? You just know somewhere over here is relief, and you're just searching for it, right? But the thing is that, you ever hear the quote of if the only tool you have is a hammer, everything's a nail? Yeah, that's what you're up against in healthcare. Because what type of diagnosis do you want? Well, that's the person you should go see, right? So the point is,
surgery, go to a surgeon.
yeah, it's true. People will go to surgeon, get MRIs generally, right? And you're 34% more likely to have spine surgery if you have an MRI. The biggest predictor of spine surgery in the world, this is published data, I'm not making this up, is guess what? What predicts most that you're going to have a spine surgery?
Going to a surgeon.
Okay, number of surgeons in your zip code. Zip code. So if you have as more Rothmans pop up, as more surgical suites, your chance goes up and up and up. Why? Because that's their specialty. They're all wearing their own little goggles, and we all have our own little worldview, just as I do, right? But the point is, a lot of us can't recognize that. We're just trained and we just buy into everything, versus stepping back and being like, oh my God, I have glasses on. I've been missing this. I gotta step back and I see the way surgeons do things. This is crazy, and this is what I've been able to do, right? So, primary care physician, you got really bad back, you need meds, right? You need MRI, potentially injection surgery. Massage therapist, myofascial release. You've got a fascial problem. You've got, all of a sudden you walk in there, you've got more knots than you know what to do with on the way out. Chiro, you thought you were fine, and they took the image, you're out of alignment, your hips out of whack, this and that, and you're like, okay. So now, in PT, your one leg's longer than the other, and you've got a weak core. That type of thing, right? So the point is that we all have our own thing, and then you have no clue what's going on. Who do you believe, right? It's tough, because you guys don't know what I do. So we try to weed through that. But the way you get to the bottom of it, no matter what you decide to do, right, is if this was 5 inches, 1, 2, 3, 4, 5, or you go 5 inches in one direction and only one direction. That's how you cut diamonds, so you cut glass, it's how you do everything in life. That's the pressure washer effect, right, versus the shower setting, all right? So for me, I'm biased. You find a thoughtful PT coach, a very good chiro, will practice very much like I will. We'll go head to head, all right? The evidence is very supportive of this for people with back problems. We save people a lot of money, avoid a lot of injections, avoid a lot of pain med addiction, things like that. So you got to stay focused with your energy, or you get lost in the rabbit hole. All right. Cool. All right. So where was I? I think this. The #1 most common cause of back problems is. Bring it down to earth here for you guys. Disc problem. Let me explain this in simple terms. Okay. 80% of back problems are due to disc problems. What's this? Yeah, so you're standing like this, looking in from the side, right? So this would be like the 4th bone in the back, L4, and this would be L5. What's this?
It's the disc.
Yeah, it's this. Some fibers on the outside that basically keep the water-like, jelly-like material on the inside. And what's behind the disc and down this little canal?
Spinal column.
Spinal cord. Yeah, spinal column, yeah.
Oh, spinal cord.
There you go, that's all right. What are these?
Nerves.
Yeah, so remember in the beginning I drew that thing with those 4 little branches? This is just zoomed in on that. So you would have another one down here technically, and that would become sciatic nerve basically. All right? So yeah, nerve branches. So what we see is that people with disc problems are generally a little bit younger, less than 50. All right? They bending, sitting, driving. They may have sciatica. The #1 cause of a disc or sciatica is a disc problem. They may be shifted. If somebody's ever bent over and picked something up the wrong way and then they look like this when they stand up and they can't quite stand up tall, telltale sign you have a disc problem. All right? Sit to stand is a problem. People sit too long, they stand up like, and then when they walk it might get a little better, they try to stretch it out, things like that. Morning, AM, stiff. Hard getting out of bed, bending over first thing in the morning, rolling out of bed, very stiff, right? And the reason is because disc pressure is highest in the morning. So you have gravity on you at the end of the day, disc pressure not too bad. Things are sort of distributed nicely, right? When you lay down, gravity is off of you. You get this like a sponge, water. Then you go and you sit up in the morning. Ow, stiff, can't move. Tough to stand up, walk out of bed like this for a moment. Right, that type of thing, all right? Leaning over the, do the dishes, stooping, these types of things. Lifting. So what's the common link between bending, sitting, driving, lifting? What's the common link? Think like a mechanic. This is what I teach you.
It's like a lever.
Yeah, think of it like movement. Think of movement, all right? So here you are. That's one person. Here's the other person. They're standing up, sitting down. Uniquely different positions. Agree? Okay, so this person, their spine would look like this, right? So if I were to zoom in, their bones would sort of look like that. Think of it like a slinky. Pretty simple, right? There's a disc in between there. Well, what happens when you put a disc in a space like this that has the ability to actually have something move? You put pressure on the front of it, which pushes the disc material towards the back. So the issue is that there's nerves back there, so it can push on nerves. Right? So this is why when you're sitting, when you're driving, when you're bending, you're lifting, often this is what will happen. And then, oh, by the way, you go to stand up after you've been sitting for a while, and this material is migrated towards the back, go stand up on that. Ooh, stiff. And then eventually settles down. All right, because it can change. It's modifiable, right? So that's the sit to stand stiffness for a first thing in the morning. All right. #2 problem.
Was that a posture issue? Or is that too simple?
It's too simple. So what we know is that there's no such thing as a perfect posture. We've done studies on it. I teach companies how to reduce back, neck, and arm problems. And what we found is that correcting somebody's posture, buying them the most expensive chairs in the world, doesn't reduce back incidence. I treat just as many people sit on yoga balls, because it makes them like this, as people sit on couches at home. Just what type of problem do you want? You're just going to load certain structures different ways.
Those big balls that people sit on don't do them any good?
No.
My sister-in-law's been sitting on one at the office for years now.
Yeah, look, they're just going to cause loading of different structures. So think about it. When you're sitting like this, you're going to put pressure towards the front of the spine, which could potentially irritate some structures by moving some disc material towards the back. This is going to, if you picture your discs and the tissue in your body like a sponge, if you sit like this, you're going to step on one side of the sponge. It's not going to have blood flow, it's not going to have oxygen, it's not going to have things to bring it nutrients. After a while, it's going to say, like, help me, right? If you sit like this all day, the structures and joints in your back, which get stressed when you close down on them, are just going to be like, dude, and the disc is going to be like, I'm fine up here. What are you doing back there? You're stepping on me, right? Get off. These are the people who have arthritic conditions, right? These are the people who are like, I get away from arthritis by trying to move forward to relieve it, but it's too far gone sometimes at that point. So it's just, what type of problem do you want? So the most important thing is posture variability. Step on one part of the spine, step on the other part of the spine. Let blood flow go back and forth between tissues. Stay moving. People have carpal tunnel when they type. Yeah, it's a blood tissue problem. It usually starts at the neck. Sensitizes nerves, because tissue can't get rid of all the byproduct of having to work so hard, because blood flow is not to the tissue, because they're sitting there wringing out their muscles because they're contracting them for hours. And all you have to do is a gentle micro stretch, a 10-second stretch that will reverse that. And we've seen reductions in workplace problems 70% by doing these
I
issues.
wish I'd done that before I had the carpal tunnel surgery.
This is why I do what I do. So education is like super powerful. But people don't understand the basics of how their body works and how tissue works, such that they don't even know what to do about it until it's like, oh shoot, I wish I would have known that, right? So, got that?
So you said the disc problem is like
Yeah.
the most percentage of it?
80% of back problems.
What can you do to help that?
Yep. So start with what nicks the scab, what starts it. It goes back to the same process to keep it simple. You have to put out the fire. What makes it better? What makes it worse? Take everything that makes it worse, slash it. Do less of that. How can I modify that? And there are a lot of ways. You can sit differently. You can drive differently. I know all that stuff. It would take me like ages to teach you everything I know. But the concept is I would coach you on, hey, this is what we have to do for this. No, you're trying that, but why don't you just do this instead? The reason that it hurts when you drive, because you're stretching your sciatic nerve. What if you just moved it 1 inch closer? Oh, now you put flex in it, and the wire isn't as stretched. Oh, now I don't have leg pain when I drive. It would have taken you forever to try to figure that out, right? But simple for me, right? So the point is that you have to put out the fire first, and then often doing exactly the opposite of what brings it on will relieve it. Meaning, I see people that sit all day, and I have somebody who does ergonomics, which is fine or whatever, but tells them, hey, when you're sitting, you've been sitting all day, just try to bend forward, stretch things out. You've just been stretching the back of your disc all day and sitting in that position, and then you're going to go do more of that as your break? Instead, it's a sponge. You've been sitting like this all day. Do this every hour, do 10 of these. Pump blood flow to the opposite end of the tissue. Now, it's person specific, right? Which is tough to like give a boilerplate thing. I have specific like exercises, some things in there for you that generally work with people for these different types of problems. But yeah, the goal is that you become an expert in your own working body such that then you can treat it yourself. And if you start to get these concepts, right, it doesn't take that long to figure them out. You just have to then start to apply them and be like, oh my gosh, right? That's that. Number two problem, stenosis. What is stenosis?
Narrowing this one.
Yeah, narrowing of the holes where the nerves exit. So narrowing via bone spurs, things like this, right? Who knows Arthur? Arthritis, right? Arthritis is his last name. Arthritis, DJD, degenerative joint disease, DDD, degenerative disc disease. These people are generally wiser, older than 50. Standing, they hate it. Walking, I don't really like it. I have to lean on a shopping cart. I have to sit for my pain to go away. I have no pain sitting. These people often have leg pain that goes away when they lean forward on a shopping cart or when they sit down, all right? They may have one or both legged symptoms. Notice this is opposite of general disc presentation. Disc problems are generally very sensitive to being in this position. These people love it. You get that? Mechanical problem, they know what makes it better and they know what makes it worse, but it's different, right? So the point is, what's the common link between what aggravates these people, standing and walking? Do they look more like this guy or this guy? This one, this is what hurts them, and they like this. This guy likes this and hates this. Right? So point is that your spine in this example looks like this. The opposite of sitting. Take the slinky the other way. So now what you have is you have joints that are compressed, and when you have arthritis, then you get arthritis because there's a law in the body called Wolff's Law. Wolff's Law is basically this law that says the body and the bones will respond in direct proportion to the amount of stress that you put upon them. Meaning, if you stress out a bone, it's going to grow more bone to try to become more robust, to try to reduce the force on it, to try to become beefier, right? Such that it can handle whatever you're throwing at it. That's cool if you fracture your leg and stuff like that, but the problem is that when these joints are being loaded for so long, what ends up happening is that your joints are about the size of my fingernail. You start stressing these things out and rubbing them, your body's going to go, they're stressing my joints in my back. The body's going to go, I know what to do, I've done this before. They're stressing the joints in my back. Send bone-making cells there. Create bone spurs. Fatten up the size of your joints so that you can handle more stress. Well, then you fatten up and make your joints more gnarly, like if you have arthritis, your knuckles get all knobby, gnarly, whatever. And what happens, right, is that there's less space for the nerves to travel. And then you pinch nerves and do things like that. All right? So that's spinal stenosis. Then when you lean forward, you open up the problem, meaning you reduce pressure on the nerves and the joints. You take pressure off of them, so therefore you feel relief. Right? Final problem.
So you can't really, that's age-related, you can't really help that, can you?
So yeah, you can. This is good. So you can help it because it doesn't have a correlation to what you're actually feeling. You just think it does because you've been told that. Right, so no correlation. In the journal Spine, the biggest journal out there in all of medicine related to orthopedic spine problems, 2017, no correlation between spinal stenosis imaging findings. No correlation between what we see, all these gnarly humps and bumps in the back, and what people actually feel. People have terrible looking spines and sometimes feel nothing. People have terrible looking spines and sometimes feel everything. Sometimes people have wonderfully looking spines and are in terrible pain. So then how do you get to the bottom of it? You treat every problem with movement. That's it. That's all that matters, is how you respond to movement. Unless it doesn't respond, then we can get more imaging. Unless we think it's more serious, cancer, tumor, infection, fracture, something like that. And then we go and we treat it. That way, we might look and see if something else is going on.
So my friend who, she just told me, I play tennis with her all the time, she has a back issue. She said motion is lotion. That's what she learned. Motion is lotion, so you just keep moving. She actually had to, when they push them together, the spine.
Fusions? Yeah.
Seems like a bad idea.
Well, the recurrence rates are very high with that. I'm not saying it doesn't help any people, but it's been compared to conservative treatment, found basically to be no better. It's a really extreme surgery compared to nothing, doing a little bit of exercise and having almost no better outcomes. You better be really sure that that should be proven pretty good. It's not. I'm not saying it doesn't help any people. I've seen some people who have terrible spinal stenosis and have had spine surgery, and they love it, if you select the right person. The problem is we're not selecting the right person. We're recommending all that stuff first, right? So yeah, so the goal, right, with any specific treatment, and we'll talk about this as we wrap up here in a moment, is that movement is medicine. If you were to take a medication, right, that wouldn't rip a hole in your belly, that could fix your back problem and give you control over it, or at least manage it such that you're 50, 60, 70% better, had no side effects, you would take it all the time, right? So you would ideally, though, taking movement as a whole sheet of exercise all the time is not ideal, because it's just not efficient. A pill is like, I can take this and be good. So what if you had something you could do that took 10 seconds and you could do it 5 times throughout the day, like a pill? Put movement in a pill. You would do it all the time. That's the goal. The goal is not just give you a sheet of things and just do it, because then you're not really specific about what you're doing. We try to find the 1 or 2 things that you can do at the end of the day, such that then you walk away out of my clinic or wherever, right, that you have a little pill that says movement, and you know exactly when to take it, when to pop it. People have back problems. They say, oh, I wake up, or at the end of the day, my back's worse. They said, I went to PT. Well, when did you do your exercises? First thing when I woke up. So you took your movement pill at 7 in the morning when you get your back pain at 5 at night. You would never do that with any other medication. But unless it's been explained to you like that and put in that specific verbiage, you're like, oh, you're right, it doesn't really make sense. If I knew that would make me feel better, why didn't I do it at 4 p.m. when I knew 5 p.m. was going to be my worst? So you put it into a pill and give it to people. All right, last thing. All right, can you hang on in there for like 8 more minutes? 8 minutes, 20 seconds? All right, cool. Okay.
25.
8 minutes, 25, thank you. Thank you. SI joint. I'm going with Cameron. We're at the beach and we're building the tower blocks. 5 bones in the lower back. Which is most important? Most important block? The one in the sand, right? This is the SI joint. From the back to the front, this is your sacrum. These are your 5 bones. You've got an SI joint on either side. Right on the knob. People say, my pain's right here. They don't have back pain. This is fine. It's just right here. Stick their finger on it, usually their thumb. Usually it's one-sided problem. It does not cause numbness or tingling because it's a joint. It can't affect the nerves. It's a joint. All right, it's not around nerves there. All right. Usually one-sided, all over the board. These are generally people that are very young and very flexible because they have their ligaments that connect these things, and they get stressed out when you move a lot. Think of a gymnast, something like that, right? These are also women before and after pregnancy because they have relaxin, which is a hormone secreted to try to ease the pelvis for childbirth. Creates a little more movement there, right? And then you have much older folks who have had fusions that say, I still need to hit the tennis ball, but you know, I can't move here anymore. So your body's not going to say, wait, stop, hold on ball, freeze. This and this. No, it's just going to move. It's just going to hit the ball. Well, if you can't move here, the body's always going to figure it out. So it's going to move somewhere else. And if you have, and specifically if you're a female or a male, but generally females, and you have some type of bone density problem, something like that, you twist excessively here at the hip or at the lower part, because this can't move, so this moves more, you fracture it. Or you get what we call adjacent segment, the segment above it or below it, that then people with spinal fusions, and often they go back, oh, this one's getting arthritis. Yeah, because you're holding the towel here and everything above it's twisting. So that's what you see, one-sided problems, pain rolling over in bed, asymmetrical movements, stepping up on a curve, lifting the leg, crossing legs, things like that will often bother this. All right, so here we go. So how do we treat it? I think you all kind of understand. The biggest thing, like, I'm a big proponent of education. Education. Teach you what to do, what not to do, how to modify things. Problem is, most treatment, if you remember that whole energy ball, right, is very passive. You go somewhere, and somebody does something to you. The problem is that doesn't teach you any more about your condition, such that then you go home, and then you're like, well, that was cool what they did there. They rubbed a certain thing, or they massaged, they did deep tissue, but then how do I do that at home? You can try your tennis ball, softball, foam roller, all this stuff, but it's just not quite the same. So then the issue is that in order to get continued relief, you just got to keep going back to that person forever. What if there was a better way? Right, so it's very passive treatment versus the goal is that we make people more active. People in my clinic treat themselves. I will do hands-on techniques. I was trained by osteopaths, some of the best around, but at the end of the day, it's only so useful. Hands-on techniques are the second way we treat things. And they have 2 purposes, and only 2 purposes. What I don't like about them is they create dependency. That person fixed me, right? Versus I can fix myself. The first thing is they decrease pain. If you look at a functional MRI, you ever see those brain MRIs where somebody's thinking and you can see what part of their brain's working? People in pain, the whole pain area as well as other areas is lit up. It hurts, right? They're guarded, they're moving funky. So you have increased pain. What we would do is we do that MRI, they come over my table, I'd crack their back, and then we'd look at the image again. Very quiet. Right after somebody got their back cracked or they got their back rubbed or something, because it feels good. It only feels good for about 24 hours. It has a reducing effect. It decreases pain, decreases sensitivity to the system for about 24 hours, right? And then it's like you walk out and then it's kind of back again, right? So that's what it does. And then it increases muscle function. MM function, whatever. Meaning, These people who have back problems, they have trouble coordinating movements. It hurts. They're kind of jittery and moving around kind of funky, right? So what we did is we measured their ability to move their hips and legs and arms and things like that. And then we cracked their back. Decreased pain, and what do you know? They could improve the ability for themselves to actually move and contract muscles by about 26%. Pretty cool. So basically, you move better. The problem is that without education and just this, you don't really learn much. Until, I'd say, the last fill in there is, you do specific stability exercises. I don't really like that term anymore, I'll get rid of it. But basically, you want to reinforce what they did to kind of reset the system. So if you have less pain after you get your back cracked or you rub essential oils on you, I don't care what it is, it doesn't really matter. Understand that this is just putting static in the system. This is like somebody comes up behind you and you're like having a bad day and they pop something behind your head. Hopefully you don't punch them in the mouth, but you're basically like, you're just shocked for a minute. You're kind of like, you forget about everything for a second. This is what these things do. Whether you're getting massage, whether you're rubbing ice on your legs or oregano oil or olive oil, I don't care what, you put ketchup on your legs and rub it around. You're gonna feel better temporarily, I guarantee it. You're gonna smell real funky. Right. But the point is that you then need to go reinforce it. That ketchup made me feel a little bit better. Well, go use it. How am I gonna use it? Teach you specific things to do such that you can keep that motion. This is where magic comes in, because then you move better. And then like the number one like painkiller in the world, what is it? Exercise. Releases natural opiates. They're stronger than painkillers, right? So then you start moving. I feel good. I can kind of do this. You gain some confidence, and then you're feeling better. You just empowered yourself to do things, right? Pretty cool. All right, last thing. Pretty sure I got like 2 minutes, 25 seconds now. All right. Okay, so pain. So let me ask you this. Well, let me say this. Basically, 80% of people over the age of 50 will have some type of herniated disc, spinal stenosis, something like that, and feel no pain, as I mentioned, right? So there's not a correlation there between images and what happens. So what's going on there, right? So what we see is pain is an experience or an output created by or from the blank. Where does all pain come from? The brain, right? So you've got time and you got pain. Think of pain as your alarm system. Here's your pain threshold. You've got 45 miles of nerves, 450 nerves just buzzing along waiting for you to hurt yourself. Give it input. Make the alarm system go chirp, basically, right? So how many people had a paper cut? What do you say? Ooh, ouch, right? And then how long do you say that for? Are you walking around for like 10 years? Ouch, 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 ouch.
Till it heals.
Yeah, until it heals. Not that long, right? And then are you thinking about it all the time? No, you like looking at paper every day being like, I don't know about you. You and I, we're not even alone. All right? No, you just go back and live your life. It's not that big of a deal, right? So now what happens, we have Beth over here has had like a 25-year-old paper cut. Basically, right? And it never went back down. You still keep annoying this thing. Or something's happening. So would it be weird if you had a paper cut for 25 years? Or 10 years, or however long you've had back problem? Freaky. You should be like, get out of here and go to the emergency room right now. If it was anything else, you would. If you had a paper cut that lasted that long, you'd be like, I have a flesh-eating bacteria. There's some tapeworm or something, fungus going around or something like that, right? But imagine if, like, every time it started to heal, you just went like, bleed, bleed. Then you'd be like, well, it kind of makes sense that I still have this problem because you're nicking the scab, right? So it could be a tissue problem. You could be nicking the scab with your back problem that every time it starts to feel better, you do stuff and you don't really know what that is. Absolutely. It's possible you could have a disc problem and actually be that you're annoying the disc. Sitting a funky way, what you do for a living, whatever, all right? It could be many things. We have to figure that out, right? But the other thing is that, like, if you're not just nicking the tissue and it's not an issue in the tissue, what else could it be? How can people have completely normal scans, no tissue problem, right, and then feel all kinds of pain, or vice versa? So tissue can't always explain it, because everyone with a problem in their back via MRI should always have a problem. Does that make sense? They should always feel something, but they don't. So it's not always this. So then what could it be? So then when you hurt your back, let's just say, when you hurt your back, you go to your primary care doc. They give you meds. They send you to the surgeon. This whole time, this whole 3 weeks, you're waiting for these appointments, you're still in pain, right? The cut's bleeding. Then the surgeon says, we're going to get you an MRI. And then the MRI says, you got the back of an 80-year-old, but you're really just like 45. And then your your significant other calls you on the way home and says, hey, how'd your MRI go? And then you're like, well, it says I have spondylolisthesis and stenosis, and then you're like, I'm pretty much screwed. So then it's like, well, it went pretty well, right? And so the point is, you're stressed out, and then it's like you're Googling everything, and who knows what you have when you look on Google, and then you can't sleep, and then when you can't sleep, like you have cortisol, and then you're more stressed out, and then your granddaughter, in this case maybe my daughter, comes up to you and says, let's go play, Grammy. And you're like, I can't, because the doctor told me I should never bend over, and I have all this stuff, and my back hurts, right? So then you're feeling like, by the end of this, I mean, you're just like looking like this. I mean, very upset. Basically, it's this experience that has blown up from this little paper cut, you bending over and doing something, to all this input. Then you got the chiropractor in there, the PT, the massage therapist, and before you know it, you've got all this stuff wrong with you that probably had nothing to actually do with what's wrong with you, by the way, right? And you're very angry, and it's become this huge experience, pain is an experience, that now it's just so blown out of proportion that you don't know what to do because you've tried everything, you're more frustrated, you're further down the hole, and it's tough to get out of. That is what you're up against. That is what I try to prevent. Because you go to PT here and you find somebody that's not lame, right, for lack of better terms, you stop this whole process, right? Because people don't know this stuff up front. They come to workshops and then learn. So the point is that, you know, pain is like the wind. You can feel it, but you can't see it. You can't just take an image. First time I went to USC with a surgeon, walked in, he said, Charlie, this person's gonna have terrible left leg pain. Just look at this disc problem. Walked right in, Mrs. So-and-so, how's your left leg? She said, well, I don't have left leg pain. She's kind of looking around. She's like, it's all my right leg. And he's like, kind of taken off. And that for me, I was like the little guy in the room. I couldn't say anything, but I was just like, oh my gosh. I remember leaving there being like, that's it. I'm so flared up by this. Right? So the point is that there wasn't a correlation there. So it really was like mind-boggling for me to see that. So yeah, pain is an experience created by the brain to protect you from some perceived threat or danger. Perceived. Okay. Doesn't always have to be real. All right. So final questions.
I saw one thing at the end.
Yeah. I'll mention that in a minute. So I do have an offer for you guys, obviously. Questions about back, leg pain? Anything I mentioned? Go ahead, Chris.
I haven't actually gone to the PT I just finished up actually the other day.
Cool.
For like almost, a long story, a couple, like
It's okay.
maybe a month and a half.
Yep.
But I've been having, it's mostly, I've been having a bunch of calls, I've been a bunch of different doctors and all this stuff.
Sure.
And they never really gave me like a diagnosis. They did say like, oh, they said I have stenosis, they have this, and there's arthritis in my neck and all these different things. But it's also like muscular too. I've been having like tightness in like the arm and all these pressure points. So I'm just saying like, I think the spine's like, my theory, like it's causing all this stuff is just causing all these different sensations in my body.
Yep.
So it's kind of like, I'm feeling a little bit better, but I'm still like not like 100%
Yep.
and stuff.
Yeah, so for you, man, at the end of the day, look, it's not ultimately probably going to matter what's really wrong with you. It's not to undermine it. It's not that it's in your head. It's actually happening. But the problem is that having a label or a diagnosis, so then you're like, okay, so I had my MRI and it's stenosis. Well, what do we do about it? You're still back in the same boat, right? So then it's like, rather than treating people by the diagnosis, start with a question. If, for you, right, if I was to work with you, I'd say, Chris, we could make the assumption potentially, just in the deck of cards, it could be from your neck. Well, then let's prove it. We're only going to treat the neck and move the neck certain directions, and it should be able to change all your symptoms. If it doesn't, that can't be the only thing.
Mm-hmm.
Is it then from the shoulder? Don't move your neck at all, and wiggle your shoulder. Okay, now we have a shoulder, now we don't have a neck. So we can't treat this, I can't give you stretches for the neck and things for the arm, because then if you're getting worse, I don't know what made you worse. If you're getting better, I don't know what made you better. I'm happy you're getting better, but I don't know what made you better, and therefore you don't. If you're the same, you just tweak it. So it all starts with a question, throw one rock in the water, same, better, worse, assess, get feedback, this is a system, a feedback loop, same, better, worse, and then from there you learn through the process. And you can start to systematically eliminate what's going on, or lead you closer to the truth. Any other questions? Good.
what is the rationale for the physical therapist giving you those, I don't know, I've heard them referred to as press-ups or
Yep.
it's pretty much spinal hyperextensions?
Yep.
What's the rationale for that? How does that help your pain?
Yeah, so, well, that would be a question that you'd have to answer during the evaluation. They gave it to you for some reason, right? But the concept is that it lives on the extremes, meaning if it's a mechanical problem, could you change it by moving mechanically, right? And what's cool about that treatment, I use it a lot, like not just that motion, but various spinal motions to try to figure things out, right? Is that if you're going to learn anything about like your problem as it comes to your back or whatever, right? You don't learn much by living in the safe zone. I'll put a little money over here, maybe a little bit. Like you go all in and live on one end of the extreme. So basically, like, if this is a mechanical problem on my back, what happens if I bend for the next day 100 times a day and touch my toes? What happens to my back problem? You will learn very quick if that is the answer to your problem. And if it's not, you'll know immediately if it makes you worse. But if it makes you better, you found the one thing. Sorry. And or with the extension problem, if the problem is generally brought in by symptoms where you're bending over, things like that, that puts you on the opposite extreme. So the point is, can you mechanically respond to a motion that lives on the other end of the curve? So you can play with extremes just like you can play with hot and cold. If you think stretching is the solution, stretch the heck out of something. For your hamstring, your piriformis. I have a video on YouTube, it kind of goes a little wild. It's like causing a ruckus now. Because it's like piriformis syndrome or hamstring syndrome, whatever. Stop stretching, start strengthening. Stretching and strengthening are opposites. They both intermingle a little bit, but really, when you're stretching something, you're taking point A and point B and you're trying to lengthen it. Chiropractor tries to move you more. Massage therapist tries to take a line and push it to try to lengthen it, right? Yoga tries to generally stretch it, something like that. Using a strap, pulls it, right? Strengthening says, you know what, I'm not going to separate 2 points, I'm going to bring them closer together by contracting. I'm going to make it more stiff. So you have stretching, strengthening. So a lot of times by using extremes of motion or extremes of treatments, a lot of people already do the work for me. I went to massage, I did stretching, I did yoga, I did chiropractic, and it didn't work for me. You did all motion things. All motion. What if instead of getting longer and more stretched out, you made yourself more stiff? So, yeah, you use, it's reasoning, I'm trying to think of a simple way to put it, but you use extremes to kind of tell and to learn more about your condition. If I want to teach my daughter, like, what's, like, I don't know, like, light and dark. Light, shut every light off. Dark, she gets that there's somewhere in between there, right? So she can learn by living the extremes. Hot, that's what she says. If I want her to figure out what cold is, I'm not going to put her, like, in kind of, like, just a little bit, like, cool water. Put her in an ice bucket. Cold. She learns. Sharp. Maybe that's not smart, but not sharp. Dull. Whatever. Right? You get the concept. So you can do the same thing with your back problems. Same thing with any problem. Stretching, strengthening. Black, white. Hot, cold. And you can learn what makes it better, what makes it worse, and what do I respond to. You can solve your own problem by living on the edges. Alright? So that's just an extreme spinal motion to see if moving it will mechanically cause a change there. Cool. Alright.
Question.
Go ahead.
So, what we're seeing is changes taking place in our bodies, I guess,
Mhm.
over a period of time.
Yep.
So I'm 69, I guess I'm not gonna feel like I'm 21 again.
Fair?
But I'd like to be able to walk, maybe jog.
Yep.
Golf without pain.
Yep.
Is that reasonable?
Yeah. Look, so yeah, he has a good point. There are reasonable and there are unreasonable goals. If I see somebody who's 69 says, I've never played in the NFL, but I think I want to try, I'm going to say,
Good luck.
well, first of all, we got to talk about this. Hold on. This is going to take a long time, number one, right? And then, but yeah, so reasonable, yeah, I can't say you're going to be 25 again,
Right.
but then we need to make your destination and every little test fit into getting you closer to that, right? Because that has to be like the end game. So then we break down specific movements, get you out of pain or reduce the pain as much as possible, and break down the specific tasks that you want to get back to. Jogging, what does that require? Golfing, what does that require? Is there something in common there that we can work on to make it a common goal, and then it'll impact, one variable will impact all of those things? Yeah, it's reasonable.
Mainly it's movement without pain.
Yes. Yeah, reasonable, because then if you find something that works, you can do it right before you golf, you can do it on the 9th hole, and you can do it at the end, take you 10 seconds. That's the goal.
Right.
So that'd be cool if you can find a movement as your medicine. All right, so I'll hang around questions. I think I close the library usually almost every time I do this, sorry Mark. But look, nobody threw any tomatoes at me, right? You all were like super interactive. Sometimes I get groups where they don't really say anything, they don't really want to know anything, but they're here for some reason, that's okay. But you all, smiles on your face. Mary Jo, thanks for your comments. Paul, for arguing with Helen over here, and so on and so forth. But what I'd like to say is, I'd like to offer every one of you here a 45-minute free consult, all right? I think it's pretty generous. I only offer it to people who come to my workshops, request my back pain book, or word-of-mouth referrals, so if somehow you can tie in some other way and you don't want to take it tonight, that's fine. But I offer everyone who comes to my workshops for their support and just for saying thanks, a 45-minute free consult with me, all right? What I do is I book out basically certain blocks of my schedule, so I have sometimes like Tuesday and then Friday, I believe, this week, right? 4 people who attend. Mark told me there were like 12 or 14 people, so I blocked out some appropriately, all right? And at the consult, what do? I sit down, I listen to your story, specific story, not general information. I wish I could make it more specific sometimes, but it's general. We go through a brief exam, whatever we need to do. If I need to review your images, we do that too. Whatever questions you have, I take that 45 minutes to sit down and really break it down. And then after going through that examination, or that mini brief exam, I have a whiteboard 3 times as big as this in my clinic, and I lay it out. Here you are. Here's what makes you better. Here's what makes you worse. Do you notice a trend? You see when you do this, this is what happens. Here's why when I do this, this hurts. Here's why it's not your hip, it's your back, or whatever, okay? Just to clear up anything. And then obviously at the end, I lay out a plan. It says, look, if you want to get to the bottom of this, here's what we're going to do, and here's what it's going to look like, and here's how long it's going to take, and here's what it's going to take from a time, energy, money standpoint, okay? That's at the end of the examination, no hiding that, all right? And then we lay it out, and we come up with a plan. If it's a fit, it's a fit. If it's not a fit, then you've hopefully taken away something from that, okay? So, did everyone get their money's worth?
Yes.
Cool. All right, so again, I have some free slots blocked out. If you want to take advantage of the console, my wife's back here. She did come on in. So you can head back there. I also have a phone too with some of the slots. We'll just kind of coordinate and you can set up a free console. Cool? I'll hang around. Thank you. Yep, if you want to do that.